My report is for the Health and Family Services Cabinet of the great state of Kentucky. Total funds appropriated to the Health and Family Services Cabinet in 23-24 is $567 million. 24-25 is $21,773 million, and 25-26 is $23,811 million. People will ask, how come the increase? The increase in Medicaid enrollment, the increase in waivers, and the increase in doing business in the state of Kentucky. For the general administration and program support area, increase of general fund by $5.2 million and restricted funds by $2.9 million in fiscal year 25, and increases the general fund by $5.1 million and restricted funds by $1.9 million in fiscal year 26 for staffing and operations of the Office of Medical Cannabis. It increases restricted funds by $1 million in each fiscal year for additional contracted services to conduct long-term care certification surveys. In Medicaid benefits, it increases general fund by $151 million in fiscal year 26, restricted funds by $400,000, and federal funds by $612 in fiscal year 26 for continuation of K-CHIP services. It increases the general fund by $7.2 million and federal funds by $18.2 million in fiscal year 25 for 500 additional Michelle P. waiver slots, and increases the general fund by $14.5 million and federal funds by $36.4 million in fiscal year 26 for 500 additional Michelle P. waiver slots. It increases the general fund by $7.4 million and federal funds by $18.6 million in fiscal year 25 for 250 additional supports for community living or SCL waiver slots, and increases general fund by $14.8 million and federal funds for $37.3 million for 250 additional SCL waiver slots. Increases the general fund by $4.8 million and federal funds by $12.1 million in fiscal year 25 for 500 additional home and community-based services, HCBS waiver slots, and increases the general fund by $9.6 million and federal funds by $24 million for 500 additional HCBS waiver slots. It increases the general fund by $3.8 million in each fiscal year to support an increase in the personal needs allowance from 40 to 60 per month. For the Department of Public Health, it increases the general fund by $5 million in each fiscal year for pediatric cancer research. It increases the general fund by $3.9 million in fiscal year 25 by $5.9 million in fiscal year 26 for staffing and operations for local health departments. It increases restricted funds by $6 million in fiscal year 24, $10 million in fiscal year 25, and $14 million in fiscal year 26 for increased enrollment and service costs for individuals participating in the HIV program, Human Immunodeficiency Virus Program. It adds language to require a report detailing the progress of the Central Laboratory Expansion Capital Project. For our Family Resources Centers, it increases the general fund by $4 million in each fiscal year for the operations of additional centers currently serving more than one school. In the Department of Community-Based Services, it increases restricted funds by $3.2 million and federal funds by $18.8 million in fiscal year 25, and increases restricted funds by $6.4 million and federal fund by $3.6 million in fiscal year 26 for 100 additional social workers over the fiscal biennium. It increases the general fund by $30 million and federal funds by $10 million in fiscal year 25, and increases the general fund by $40 million in fiscal year 26 to maintain reimbursements to child care providers for CCAP families at the 80th percentile of the market rate survey. for the Department of Aging and Independent Living. It increases the general fund by $10 million in each fiscal year to continue the expansion of the senior meal program. Thank you, Mr. Speaker, and I yield back to the gentleman from Todd 16.